Hi, I'm Dr. Mindy Ross. I'm a pediatric lung specialist at UCLA Mattel Children's Hospital. Thanks for joining me today. Today's webinar is going to be about obesity and asthma. If you have any comments during the talk, please tweet us or comment on this Facebook live stream. And the goals and objectives of the talk today are to answer your questions, first about what is obesity-related asthma, why should I be concerned if my child has it, and what can be done about it. The outline of the talk will be first, I will give an overview about obesity by itself, then asthma by itself, and then connect the two to talk about obesity-related asthma. And first up is obesity. So what's the definition of obesity? It's the abnormal or excessive accumulation of adipose, which is commonly known as fat tissue in the body, and this may impair health. So your doctor can quickly calculate the body fat percentage of your child by taking their weight and divide it by their height. And this can calculate the body mass index. The equation is the weight in kilograms divided by the height squared. And then they take this number, the BMI, and compare it to other children of the same age and sex. And if your child's BMI is above the 95th percentile compared to all the other children, then that is considered obese. Now this BMI number is not perfect, it's just an estimate of the body fat percentage, but it's been shown to correlate pretty well and we use it frequently in children. So next I have some pictures to demonstrate the idea of this body mass index and what it's trying to represent, which is the percentage of adipose or body fat tissue in the body. And so I have some pictures here, some body images of the non-obese an obese person. And for reference, these black areas are the lungs, this is the heart, and this is the liver. And it's a slice through the body this way. And so as you can see for the obese person, there's that accumulation or the extra tissue in yellow, which is the adipose or body fat tissue. And you can imagine how this may push on the body, potentially causing some breathing trouble. I have another picture which shows a different perspective of this, of CT scans of the chest. First in the non-obese person and the obese person. And for reference, these people are on their back. This is the spine or the vertebrae. And the anatomy or the black areas are the lungs. And this area is near the heart. And you can see the difference for the obese person with the accumulation of that extra soft tissue around the lungs. This is the adipose or fat tissue that can compress or push on the lungs and the airways. And so the statistics for obesity. The Centers for Disease Control estimates that over 12 million children in the United States are obese. This is about 17% of all children, and it's approaching 1 in 5 children. Other than dental cavities, obesity is one of the most common preventable chronic diseases of childhood. And it has been shown that one's lifestyle can actually lead to obesity. And there are many preventable lifestyle contributions. And these include eating more processed and packaged foods with high sugar content, eating larger portion size or having too many servings of food, more sedentary time, and this is more time sitting around, watching TV, on the internet, using portable devices. Over the years, people are less active, they get less exercise, and less sleep has been shown to lead to obesity. And this is because it's thought that less sleep causes more stress hormones and other hormones that can lead to weight gain. And so why do we make such a big deal about obesity? Why are we so concerned? Well, it causes many, many, many health problems, and it can even shorten your child's life expectancy. It affects every part of the body, and I'll review some here from head to toe. First, neurologic issues. Obesity may lead to headaches. Psychological, such as low self-esteem or mood disorders like depression. Cardiovascular, such as strain on the heart, high blood pressure, high cholesterol, clogged arteries. Hormonal, such as diabetes. Gastrointestinal issues, such as liver disease, and something called gastroesophageal reflux, which is more commonly known as GERD or heartburn. It can even affect the bones and joints and cause pain and back pain. And last but not least is obesity can affect the respiratory system, which is what we as pulmonologists are very interested in. And there are a few ways that obesity can do this, can affect your breathing. First, it can interfere with sleep. Obesity can block the airway during sleep and cause sleep disturbance. A very common one that it can contribute to causing is obstructive sleep apnea. And this is when the airway is blocked during sleep. And some signs that people may have obstructive sleep apnea are that they snore, there's pauses in breathing, and we're concerned because this can lead to low oxygen during sleep. And so also it can affect just breathing. It can cause shortness of breath, exercise intolerance, and as you saw from the pictures before, it's because of the extra tissue compressing the lungs. And also, it can lead to asthma or worsening asthma symptoms, which is the next portion of our talk. We'll talk about asthma. So what's the definition of what is asthma? It's a chronic, long-term inflammation disease of the airways. And to show this, I have a couple pictures of the lungs, the airways inside of the lungs of a non-obese person first. So you can see this airway, the little tube, the air tubes that people breathe through, is nice and open. The smooth muscle around it is very relaxed. The air can flow nicely. And then we compare it to an airway with asthma, affected by asthma. And you can see there's quite a difference here. And so what might be causing this difference? Well, in asthma, the smooth muscles around the airways are just more sensitive to triggers in the environment, like viral illnesses, dust, pollen, smoke. Cold air is a common one too. And these smooth muscles are more sensitive and they can spasm and close and block the airflow. Also, the inflammation that we've talked about can cause more swelling, mucus, thickened, and clogged airways that blocks the airflow. And this blockage of airflow from the mucus or the muscle spasming can be reversible on its own, but most of the time, a lot of times, you need asthma medication for this. And this airflow, the blocked airflow, can show up in people in many different ways. But the most common ways it presents or shows up are wheeze, cough, shortness of breath, or chest pain. And the hallmark of asthma is that the symptoms come and go. So it's very unpredictable. Some of the statistics on asthma. The CDC shows that it affects over 6 million children in the United States, close to 8% of all kids, and this is approaching maybe 1 in 10 children have asthma. It can start at any age, but more commonly presents or shows up in childhood. And it has been shown over recent years that there are different types of inflammation cells in people with asthma. There's a variation. For example, people with allergies and asthma or allergic-related asthma have different type of inflammation cells than people with obesity-related asthma. And this is important because it's thought that people may respond differently to different asthma medication. And the symptoms of asthma their impact on health that you might come across or find are that it can cause difficulty breathing, shortness of breath, chronic cough, and children can be less active if their symptoms are out of control. And if they're less active, this could lead to more weight gain. Also, if the symptoms are out of control, this can lead to poor sleep because they're waking up at night, coughing, and having trouble breathing. Also, children can miss school and parents can miss work because of asthma exacerbations and more frequent doctor visits. And if children are missing school, we're concerned that this can lead to poor school performance. Also, if children aren't getting a good night's sleep or they don't feel well, then they may have trouble concentrating. There can also be symptoms of daytime sleepiness, hyperactivity, and attention deficit. And the important thing is that people with asthma plus obesity-related asthma, all of these issues are magnified. And that leads us to the last portion of our talk, which will review obesity-related asthma. And so some statistics on this. Over recent years, it was realized that there are increasing numbers of people in the United States with asthma as well as obesity. And according to the CDC, it varies state by state, but anywhere from 29 to 48% of adults, and that's approaching half of all people with asthma, are obese. So this made people look into this more and say, is obesity a risk factor for asthma, or what's the relationship here? And it was shown that people who are obese are more likely to have asthma. It's estimated that about 11% of adults who are obese have asthma, as compared to about 7% of non-obese adults have asthma. And the numbers are thought to be similar in children. And the final thing is, there's more healthcare utilization by children and adults with obese-related asthma. This means that they have more asthma exacerbations, they're on more medications, more doctor visits, and even more of a risk to be hospitalized. So how does obesity lead to asthma? Research is ongoing into this topic, but some reasons are there's more inflammation in general and different type of inflammation. People with higher body fat percentage have been shown to have higher markers of inflammation. This is because fat cells themselves send signals that trigger or activate inflammation throughout the body, and this can affect the lungs. Also, as we saw in the pictures before, there are lower lung volumes in people who are obese. That extra tissue, adipose or fat tissue that pushes on the lungs, can narrow the airways and irritate them, leading to some sensitivity and inflammation to environmental triggers such as the dust, pollen, cold air, viruses, or smoke exposure. And also, people who are obese have some other health complications that are known to worsen asthma. And these include the obstructive sleep apnea and heartburn. And so how do we go about treating obesity-related asthma? It's a comprehensive approach with a few factors that we'll touch on here in the following slides. But we want to make sure that people are on the most appropriate asthma medication. We want to focus on weight loss, not only for asthma symptoms, but overall health. And we want to find and treat those other health conditions that can make obesity and asthma worse. And so asthma treatment, it's very important not to undertreat asthma. By aggressively treating asthma symptoms in your child, there's more of a chance that the symptoms will be under control, they'll be able to be more active, and then have the best chance of losing weight. And if their symptoms are significant enough, they will be on a daily controller medication. And this is known as the slower acting or preventive maintenance medication. And these medications are designed to help calm down that inflammation in the airways and lower the amount of inflammation. And examples of these types of medications are inhaled corticosteroids that people breathe directly into the lungs. An example of this is one medication called fluticasone. Another type of medication that's a controller is a medication that you take by mouth. One is called montelukast, and this works on other pathways of inflammation in the body. So it's thought that some people with obesity-related asthma may respond better to one medication or the other, and research is ongoing into this. Either way, your child will be on a fast-acting, as-needed rescue medication. And this is medications such as albuterol. And these medications, they're not steroids, but they're designed to work quickly on the smooth muscle in the airway to help relax and open up the airways so that air can flow better. And so the point of all this is that we want to make sure we prevent, in all these medications here, prevent asthma exacerbations, or if there's going to be an asthma exacerbation, hopefully not, but if there is, it won't be as severe. Our goal is to prevent kids from being in the hospital or from needing lots of courses of steroids by mouth. And you can see this is our list of the many medications to choose from. And on the top are the fast-acting rescue medications, and on the bottom are the controller medications. So since there's a lot to choose from, and there's a lot of challenges to obesity-related asthma, if you and your physician are having trouble controlling your child's asthma symptoms, they may refer you to an asthma specialist, like us pediatric pulmonologists. In our clinics, we have specialized lung function testing where we can assess, measure, and monitor the impact of obesity on the airway. We can also manage and diagnose asthma. There are comprehensive symptom evaluation surveys. We have specialized asthma surveys and detailed questionnaires that we have you fill out every time you visit, and we can track symptoms over time and make sure we're treating your child's asthma the best way we can. And very important is that we have multidisciplinary asthma team care. This includes members such as our dietitian who's available. We have a certified asthma nurse educator and respiratory therapists. So we all work together to provide you and your family, child with the best education. And of course, important is one of the most important items in obesity-related asthma is weight loss. The goal, if your child is obese, is to decrease their body fat percentage. And research has shown that weight loss helps symptoms of breathlessness and lung function in people with obesity-related asthma. So how to do this? It's still the age-old diet and exercise. May entail a lot of lifestyle changes for your family, or maybe not, but a quick review of those things are to eat less processed and packaged foods, less sugary food and drink, less fried food, to eat less portion sizes, smaller portion sizes, and less number of servings, to be more active and move around more, get more exercise, less time sitting around with less screen time, watching TV and whatnot. And also important to get more sleep. And again, these are all challenging things to do, but especially nutrition. So if you need a little extra help, you can get extra sessions with a dietitian. Or there's a lot of programs available, commercial, online, books. In the community, there's programs. It's just important that the most important is everyone's different. So you have to find what works best for you and your family. And only in very rare and extreme circumstances would people consider medications or surgery for children. This is the hope. The hope is that it doesn't get to that point, and because obesity is preventable, we think there's a lot of other approaches to go about helping with weight loss. And finally, it's important to find and treat those other health issues that may worsen obesity and asthma. And these include the ones we mentioned before: obstructive sleep apnea and heartburn. But also don't forget things like depression, because this may make people less motivated to be active and exercise, and then can lead to weight gain. Important to treat allergies. This can, like environmental allergies, this can block the nasal passages and also trigger asthma or make asthma worse. And also rare, but there are medical conditions such as low thyroid or genetic syndromes that can contribute to weight gain. And you may be referred to a specialist for any of these items as well. So our summary is obesity-related asthma requires special management considerations. And please talk to your doctor if you're concerned your child is obese or their obesity might be contributing to breathing problems. And in our pediatric pulmonology clinic, we're all trained to treat, diagnose, manage obesity-related asthma, so feel free to check out our website here. And then, got that. And then if you have any questions, please tweet them. All right. So one question here is, how often does my child need to be seen for their asthma? Good question, as I'm sure they all are, but this varies actually. It can be anywhere. If your child's having an exacerbation, we may want to see them weekly, but for usual maintenance, it can be anywhere from every month to a few months to see if the medications we've started, how they're responding to the medications and if they're working. Okay, if my child is obese, do they automatically need asthma medication? Right, yeah, no. Fortunately, we'll only have to consider asthma medication if they're showing any signs of asthma symptoms. So if they're feeling short of breath when they're exercise or when they're active, if they have cough at night or in the day, or if they have any chest pain or other feelings such as that, please talk to your doctor about it. But fortunately, no, if your child is obese, they don't automatically need medication. And here's one. My child often has shortness of breath. Is that from obesity or asthma? And the answer is not always straightforward, and that's why it's great to do a little more investigation into that, because sometimes it does take the special lung function testing and completing all the asthma surveys to tell if the shortness of breath is from the obesity, the soft tissue pushing on the lungs only, or if there's an asthma component to it. So it could be one or the other or both, and that's what we're here to help figure out. And then, my whole family is overweight. Is it just in my genes? How can I ever lose weight? It's a good one too. So yeah, there is a lot of ongoing research on the relationship of genetic factors into asthma and obesity. And there are some hints that there is some relationship. So some may be up to fate, but it's still possible within your own body frame to be at a healthy height and weight and body mass index. So it's still possible. And again, if you need any extra support, please contact your doctor and look into formal programs as well, or specialists. Okay, anything else? Okay, looks like that's it. Thank you for joining me today. Please check out our other pulmonary webinars out on our website. And let us know if you have any suggestions for future topics.